Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and parliaments for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor as your servants, whom you have been pleased to call to the performance of important trusts in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory and to advance the peace, prosperity, and welfare of our country and of those whose interest you have committed to our charge. Amen. Clerk, next order.
Order number 1, administration of oath.
Next.
Order number 2, communication from the chair.
No communication. Next.
Order number 3, messages.
Next order.
Order number 4, petition.
Next.
Order number 5, papers.
No papers. Next.
Order number 6, notices of motion.
No notices. Next.
Order number 7, statements.
Next order.
Order number 8, motion.
There is a motion by the Honorable Njuguna Mwaura, Chairperson, Committee on Health Services.
Thank you, Madam Speaker. I'm Francis Mungai Kuria, MCA elected by the great people of Malewa West Ward. I beg to move a motion, Madam Speaker, on Committee on Health, report on the visit to Arus Dispensary on 18th April 2024. Madam Speaker, as I move this motion, when I talk about health, we are talking about status of being free from illness and injuries. Committee mandate. Honorable Speaker, the Sectoral Committee on Health Services is established under the second schedule of the County Assembly of Nakuru Standing Orders and is mandated to do with all matters related to health services, including in particular county health facilities and pharmacies, ambulance services, promotion of primary health care, licensing and control of undertaking the sell food to the public, crematories, funeral parlors, and crematoria. Licensing of dogs and facilities for their accommodations, care and burial of animals, water and sanitation services, refuse dump and solid waste removal. Madam Speaker, this committee comprises of 21 honorable members of this honorable house. Madam Speaker, the objective of this visit was, one, to assess the infrastructural status of our Arus Dispensary. When we talk of infrastructure, we are talking about the buildings that are there within the facility. Ascertain the quality of services offered to the members of the public. Madam Speaker, remember we have been having a lot of complaints within the facilities, so this was the objective to visit that facility. Establish achievements made, challenges, and areas of improvement on services delivery. Madam Speaker, I wish to thank the members of this committee for their commitment during the committee visit to Arus Dispensary on 18th April 2024. I also wish to thank the Office of the Speaker and the clerk for the facilitation during this visit. Madam Speaker, when we say we are thanking this office. It's with your permission that you make all these honorable house to go and visit those facilities, that is including the transport services. On behalf of the committee, Madam Speaker, it's my pleasure and duty to present the report of the Committee on Health Services visit to this facility. With your permission, Madam Speaker, allow me to give background information of Arus Dispensary. Honorable Speaker, Arus Dispensary is located in Solai Ward, that is Rongai Sub-County in Nakuru County. The facility was started in 2019 as a community initiative where they agreed to purchase 2 acres of land, and one member of the community proposed to provide the land with an agreement of the community buying the land. The lands belong to Mr. Kipkemoi Tonui, and in the process, payment was not fully settled where there were pending payments of Kenyan shillings 800,000. The owner, Mr. Kimoi, retained 1 acre of the land due to pending payments. Madam Speaker, the county government of Nakuru built the facility which lies on 1 acre piece of land, and it's not fenced as of 2021. The facility was operational and regulated by the Ministry of Health under registration number 25037. Madam Speaker, if you can look at the pending bill of 800,000 shillings, the facility was allowed to use 1 acre due to the pending bill. So it's the mandate of the Department of Health to allocate the other funds so that they can use the entire land. Services offered at Arus Dispensary. We have the short-term family planning methods. Madam Speaker, when we talk of short-term family planning methods, we have various, that is like the barrier methods, that is maybe using of condoms, hormonal services, that is like pills, we have the patch, and we have the vaginal rings. Madam Speaker, we have the outpatient curative services. Those are services, something to do with antibiotic, maybe bacteria infections. We have the focused antenatal care, that is the physical examinations. We have the lab test. We have the personal and social history taking of an individual. When we talk of short-term family planning, Madam Speaker, the following are the services offered. We have the oral contraceptive, we have the injectable, we have the male condoms and the female condoms. When we talk of outpatient curative services, we have the general consultation, diagnosis and treatment. We have the prescribed drug administration and dispensing, management of chronic ailments, that is HIV and AIDS. We have the diabetes, we have asthma and hypertension. We have health and wellness education to various conditions. We have the family planning, that is midwives and postnatal services. When we talk of focused antenatal care, Madam Speaker, focused antenatal care aims to promote the health of mothers and their babies through targeted assessments of pregnant women to facilitate identification and treatment of already established disease, early detection of complications and other potential problems that can affect the outcomes of the pregnancy. Honorable Speaker, we have some of the infrastructural structures that are attached in the tablets there. You can review. Honorable Speaker, we come to staff establishment. The facility establishment is as follows. 1, we have 1 nurse, Honorable Speaker, in that dispensary. 2, we have a cleaner. And 3, we have a security personnel. When you just look at the number of staffs, Honorable Speaker, you can see there is a shortage of nurses, but we will capture that in the committee findings. We have the committee findings and observation. Honorable Madam Speaker, the facility has shortage of staffs. If you look at the numbers, we have 3 staffs, but specifically in the staff, we have just 1 nurse who is offering the services delivery to the common mwananchi. The cleaner and the security personnel, Madam Speaker, yes, they are under the county government, but you cannot call that as someone who can offer the services to the facility personally to the patients, so we need more staffs. The facility has no water. The facility does not have electricity. Honorable Speaker, when you look at this area of electricity, all public utilities, Madam Speaker, are supposed to be having a source of energy. So we have a mandate there so that we can be able to know how we will have electricity on that area. And it was established nationwide that all public schools, health facilities should have a source of energy. The common illness in the facility are respiratory infections. Madam Speaker, you see, due to climate change, we have been experiencing a lot of diseases capturing areas with the respiratory system. The facility is not fenced, Madam Speaker. That makes insecurity, not ensuring there is insecurity in that facility. That shows that the facility needs to be fenced. The facility has not formalized the 1-acre land ownership documents, Madam Speaker. It has been an issue with all or half of the health facilities within the county, Madam Speaker, because of having no RAD ownership. You cannot prove. We have the committee recommendations, Madam Speaker, that the county government of Nakuru should ensure timely and sufficient supply of drugs. Madam Speaker, most of the facilities in level 2, level 3, we are experiencing a shortage of drugs. So we find as a committee that the supply of these drugs should be supplied accordingly, and all drugs should be supplied to those facilities so that those patients can, when they go to seek for medication, can get or can access or can acquire the drugs faster. That the county government of Nakuru should allocate more resources in this financial year, that is 2025-2026, for 1, recruitment of staff such as nurses. Madam Speaker, having a 1 nurse in such facility, it's let me say, it's not that nurse is not sufficient to serve the purpose. Noting that he or she, the facility just have the cleaner. You cannot say the cleaner can serve the purpose on matters to do with health. If you look at the fencing, the facility has no fence, Madam Speaker. So you find even the huntsmen, they are just, even the public are trespassing the facility. So we have issues of insecurity. So this facility, Madam Speaker, should be fenced, and more so, if you look at it keenly, we talk of 1 acre, Madam Speaker. Due to the demand of rats, the price of 800,000 on the other acre that is remaining there, the department should fast track on how to purchase the other 100,000, the 1 acre, so that the facility, remember we are growing, Madam Speaker. We have other activities when we purchase that land that are going one-on-one with matters to do with health, that can be placed or equipped in that piece of land, Madam Speaker. That the hospital management should not work should work in collaboration with the health department to solve the electricity and water problems in the facility. Madam Speaker, this is a big challenge because you find most of our health facilities having no energy. Sometimes you see we need some equipment or assets like accessories like a refrigerator, where it's a cooling system where the medicines are being stored. Some medicines are very unique because they need a certain room temperature to be stored. That the county government, through the Department of Flood, Housing and Physical Planning, should expedite the formalization of the land ownership document for the facility. Madam Speaker, the issue of land ownership within the county, and I said, even using my ward, Malewa West Ward, Madam Speaker, we have about 4 facilities, but within the 4 facilities, only one that is that is in government land. The others lack facility, that lack the title deeds. So it's now here. It should be addressed an emergency, Madam Speaker, that all the health facilities, regardless where the funds to facilitate the conveyance fees and where to get the title deeds. So they need to fast track this issue so that we can own those facilities, Madam Speaker. Remember, anyone as at now, when a facility has no legal document, anyone can come and claim that facility. Or he can say, the facility was built illegally here, so you can move away this structure because I have the title deed. So can the Department of RAD, Madam Speaker, do fast track to make sure that all health facilities within the counties are legally owned by the county and the documents are there. So I therefore ask Honorable Majority Whip of this Honorable House to second this motion. I beg to give Honorable Madam Speaker.
Madam Speaker, having been present during the site visit and having keenly read and listened to what my colleague has presented, I do hereby second that motion. Thank you.
The motion is properly seconded, and the motion is that this House adopts the report of the Committee on Health Services on the visit to Arus Dispensary held on 18th April 2024, laid on the table of the Assembly this Tuesday on Tuesday 29th April 2025. The motion is open for debate. The Honorable Grace Mwathi.
Representing the people of Bahati and a member of the Health Committee, and I've stood to support this motion about the visit to Arus Dispensary, where I also visited and observed some things that ought to be done to this facility. One, as the mover has said, the facility is not fenced, and it lies in a 2-acre land, which when we went there, the other acre was cultivated, and there were some goats who came to to our facility to look for the grass which is there. And I'm telling you, Madam Speaker, that this facility is located in a very, very, very good place because it is at the far end of Solai, and it has a very big population. And the facility is very beautifully constructed. It is very clean, In fact, we admired that facility. And as the mover has said, it has only one nurse. And this one nurse is the one who serves every patient who comes to that facility. She's the one who gives drugs. She's the one who gives the injections. She's everything in that facility. And so the workload is so big, very huge in that place. Another thing, Madam Speaker, our facilities have got issues with title. And in this case, when that land lies in a 2-acre land and the other one belongs to the owner of the land, one day, one time, not only him, and God forbid, when he's not there, the children can say that they were not consulted about giving out the other land. So I would also wish that the Department of Health to work with speed to purchase the other 1 acre of land, because the owner told us that he's ready to give out the land, but he has not yet. The consultations have not been done. And when they consulted, he has waited for a long time, and the payment is not done. Madam Speaker, in that facility, there is no water. In fact, we observed it. The security person is the one who goes for water a distance from the facility. And you can imagine a health facility without water. And water is used in every area. From the nurse after she serves a patient, sterilizing those utensils that she has used. Water is key in every facility, in this case, the healthy facilities. So, Madam Speaker, I would also wish that this House passes this motion so that the executive may work hand in hand with the MCA for Solai, Mheshimiwa Morogo, to do what is remaining. Because, according to me, fencing is key. Because when a land is not fenced, it is entitled to be passed by everybody. In fact, when they are crossing to the other side, they use a road there. They have permanently made a road, which they pass to the other side. And that may cause insecurity. And as we all know, the healthy facility has to be private, because there are so many people who comes to that place. Maybe you don't want to be revealed what you are passing through, but when everybody sees you there, it is not very wise. So, Madam Speaker, I second the motion. I support the motion that the executive of the health department in the executive to do what is needed of them, so that this facility may be of great use to those people. Thank you.
Mheshimiwa Wathiai.
Asante sana, Madam Speaker. Kwanza kabisa nataka kushukuru komiti ya Health kwa kufanya kazi nzuri ya kwenda pale Arus na kuletea hii report kwa hii nyumba. Na niseme ya kwamba wakati nimepitia hii report nimeona ya kwamba hospitali yenyewe imejengwa kwa shamba ambayo nusu mwenye ilikuwa inanunuliwa na county government ya Nakuru, na mwenye shamba amelipwa pesa nusu na hajalipwa pesa ingine. Hili si jambo la kuchukulia kwa mzaha, kwa sababu kama shamba imelipwa nusu na already washatengeneza hospitali kwa hiyo shamba na mwenyewe hajalipwa ya shamba yote, huyu mwenye hii shamba ana uwezo wa kuenda na kufence hiyo shamba mahali hiyo pesa ililipwa, aseme hiyo ndio upande hospitali, pande nyingine ni yake, na hata auzie mtu mwingine. Hata waleo mwenye hiyo shamba akipata mtu anampatia pesa mzuri, anaweza amua, kwa sababu ni willing buyer willing seller, anaweza amua arudishe ile pesa county ilimpatia, auzie mtu mwingine hiyo shamba, na bado ilhali kumejengwa hospitali hapo. Madam Speaker, it's a matter of concern, Madam Speaker, kwa sababu county inaweza kuwa itapoteza mali kwa sababu iliwekeza kwa ile kiwanja kwa sababu ya kukosa kulipa ile shamba ya huyo alikuwa anauzia county. So mimi nitaomba department ya lands iharakishe na imalizie mambo ya kulipa ya shamba kama hii ambayo inajengewa kitu ya maana kama hospitali, ndio hata in future wakitaka kuexpand hiyo hospitali itakuwa ni rahisi, Madam Speaker. Otherwise kama mimi ndio ningekuwa mheshimiwa Solai, mimi ningetafuta huyo mwenye hiyo shamba nimwambie fence nusu huku, wewe fence huku, hao wamelipa pande nyingine, wacha wakabaki nayo pande hii ni yako. Ndio tuone kama hiyo ita motivate hao watu kukuja kulipa hiyo shamba nyingine. Kwa hayo machache nina support hii report, na kwa vile imeletwa nitaisupport 100%, na niombe department ya lands ishughulikie hiyo shamba. Asanteni sana Madam Speaker.
Thank you, Mheshimiwa Mwaura.
Asante sana Madam Speaker kwa kunipea hii nafasi ili tuweze kuchangia hii mjadala muhimu ya hii hospitali ya Arus pale Solai. Kwanza Madam Speaker, ningetaka kushukuru kamati ya afya wakiongozwa na chairman kwa ile kazi ambayo wamefanya vizuri ya uchunguzi kuhakikisha ya kwamba wameweza kupata kujua vile hiyo hospitali ya Arus iko. Madam Speaker, ningetaka kusema ya kwamba tumepitia vile Mheshimiwa Kifaya ametupeleka na tumeona ya kwamba hiyo hospitali ya Arus iko na changamoto mingi sana Madam Speaker. Ya kwanza tumeona ya kwamba iko na shamba ambayo ni eka 2 na shamba ambayo inasemekana ya kwamba iko na deni ya shilingi 1800, ambapo Madam Speaker hatujaweza kuambia vizuri ya kwamba hiyo shamba iliuzwa pesa ngapi na zile pesa ambazo zililipwa ni ngapi, pia ndio tuweze kujua hizo pesa zilibaki shilingi 800 kwa nini hazikuweza kulipwa. Ya pili Madam Speaker, ningetaka kusema ya kwamba tujaweza kuambiwa vizuri ukiangalia zile mambo ambazo tumeambia hakuna maji, hakuna stima. Pia Madam Speaker, tungeambia kwamba tungeweza kuambia vizuri kama hiyo hospitali iko na vyoo, kwa sababu kama inakosa kila kitu Madam Speaker, it is good tuambie kila kitu ambayo iko pale na zile vitu ambazo hakuna pale. Madam Speaker, ni vibaya sana kwa hospitali kama hiyo ya Arus kuona ya kwamba iko na wafanyikazi 3 peke yake. Mfanyikazi wa kwanza ni nurse mmoja, tumeona iko na mtu wa usafi kufanya usafi pale mmoja, na pia tuko na mtu mmoja pale ambaye ni mlinda usalama pale kama watchman. Madam Speaker, tungetaka kujua ya kwamba hiyo hospitali ya Arus ni wagonjwa wangapi wao wanatibiwa pale kwa mwezi mmoja, so that we can be able to know kwa nini tuko na shortage ya wafanyikazi. Ati nasi mmoja kwa zile services ambazo mwenyekiti amepeana pale, kama huyo nasi mmoja anaweza fanya kila kitu pale. Kwa hivyo Madam Speaker, ambapo amependelea kwamba pale waweka mapendekezo ya kwamba tukuwe na wafanyikazi wa kutosha, ni vizuri tujue kama pengine ni watu 5, tujue kama huyo nasi mmoja anaweza washughulikia Madam Speaker, ama kama ni watu 1000 ambao wanaenda pale kwa mwezi tujue ni wangapi, so that wakati tunapendekeza pale tukuwe na staff wa kutosha, tunaweza kuwa na uwezo wa kujua tunaongeza staff ili wafanye kazi gani Madam Speaker. Kwa hivyo tungeomba ya kwamba zile mapendekezo zote ambazo zimewekwa hapa ni vizuri, wakati mwingi huwa tunapendekeza, tunaweka recommendation, lakini Madam Speaker, hatujaiambiwa ya kwamba hizo hospitali zote ama zile mapendekezo ambazo tumeweka katika motion ambazo zimeletwa hapa kwa bunge ni mapendekezo mangapi Madam Speaker zimekuwa implemented Madam Speaker, so that tusikue tu hapa sisi kama bunge kazi yetu ni kupendekeza na kufanya research ya kuona ni nini inatakana, alafu Madam Speaker hakuna kitu yote ambayo inafanyika. So Madam Speaker, mimi nisema ya kwamba maneno ya fencing, tunakuta hospitali haina fence, ni kuoneshana Madam Speaker pale hakuna security ya kutosha, na anybody from anywhere anaweza kuja pale na ingie na anaweza iba zile vitu ambazo ziko pale za hospitali, na madam hiyo ni hasara kwa serikali ya county. Kwa hivyo tunapendekeza pia hiyo fence kama inawezekana iwekwe haraka iwezekanavyo, Madam Speaker. Kwa hivyo Madam Speaker, mimi naunga hii hoja mkono, lakini kwa mapendekezo kwamba yale mambo ambayo yamependekezwa hapa yaweze kuwa implemented so that hata ule wa MCA wa pale kutoka hiyo maeneo ya Solai Bwana Morogo hata yeye apate kuridhika na hayo na hiyo hospitali ya kwake, na wananchi wa pale pia wapate services ambazo zinafaa. Asante sana Madam Speaker.
Majority Leader. Deputy Majority Leader.
Thank you. Thank you, Madam Speaker. Nimesimama pia kuunga mkono hoja ya siku ya leo. Licha ya kwamba kuna mambo fulani ama mapendekezo fulani ambayo ningependa kuyapitisha. Tumeona hali ya dispensary ya Arus ni hali ya kufedhehesha, na nikiangalia hii Arus Dispensary naona inafanana kama dispensary ya kwangu Gilgil Ward ya Karura, ambao pia hali yake ni vivi hivi kama vile nimeona katika hii dispensary ya Arus. Hakuna ua nzuri katika hii dispensary, wafanyikazi ni wachache, na vile vile nimeangalia katika hii ripoti ya Arus tumepigwa picha moja tu ambayo ni ya jina, mahali jina liko. Ningependekeza kama mpiga picha angetumia kamera ya rangi na vile vile apige sehemu nyingi, kwa sababu inaonekana kwamba kuna mambo mengi fiche yako katika hii dispensary. Tungeona idara mbalimbali na vile kunakaa ndio tuweze kutoa ripoti kamili kuhusu hii dispensary. Kwa hivyo ningependa kuomba wizara hii ya health, ambao katika bajeti yetu ya county ndio hupata mgao ule mkubwa zaidi kuliko department zingine, na katika hizi facilities za health nimeonekana ni mbovu, na tumekuwa na hii mijadala ya kuhusu dispensaries, health centers ambazo zimekuwa kila saa na walakini. Kwa hivyo hii idara iangalie facilities katika hii county yetu na iweze kuimprove, ili tuone huu mgao ambao huwa tunawapea uko na the value we get from the money ambao huwa tunawapea. Kwa hivyo Madam Speaker, naunga mkono na kupendekeza ya kwamba committee ya implementation ipitie hizi hoja, yani hizi recommendations zote ambazo members wamekuwa wakipeana kuhusu kazi ambao hii idara ya health inastahili kubadilisha ama kuangalia, tuone kama ni kuongea tu huwa tunaongea, ama tukirudi nyuma tuanzie mwanzo mahali tulileta, tuone kama wamekuwa wakifanya kitu. Isikuwe ni kusema tu tunasema ilhali hakuna kazi inaendelea mashinani. Wakati Wanjiku anaenda katika health center, huwa hapo ako na matarajio kwamba atapata huduma nzuri na atakuwa ametosheka, lakini akienda napata hata facility yenyewe haiangaliwi vizuri, wafanyikazi si wa kutosha, pia wanalia madawa hayako. Hapo kuna changamoto Madam Speaker. Nimeunga mkono mjadala na niseme ya kwamba tuangalie kwa makini ili tuweze kufanya ili hii department iweze kufanya kazi nzuri. Asante Madam Speaker.
In the order of seniority, let me have the majority whip first and then Mheshimiwa Kanyeri.
I just want to challenge my fellow MCAs in the House concerning these reports. We go for site visits. We see what we see during those visits. We come back here with very beautiful reports with observation and recommendations. Na vile wengi wamesema issue in implementation. So I want to challenge us that we need to come up with a roadmap in terms of timeline to ensure that these recommendations that we put in those reports, that after a certain period of time, we need to relook and revisit them. And maybe this can be placed within those specific committees, because I have convinced myself where I sit that at a time like this next year, God willing, if you were to go to Arus again, we'll either find it the way it is or even worse. So I think we need to put timelines within our specific committees on such reports, that yes, we have seen what we have seen in those facilities or in whatever areas that we have visited. Now we engage the relevant department and we come up with clear implementation timeline. Then after a specific period of time, we revisit those sites again to ensure or to confirm if things have really changed. That way, we'll ensure the people from our wards, specifically from Solai, on that specific issue on the floor of the house, get value for the taxes they pay. So it's a challenge to my colleagues that as we stand here, eloquently read this report like my brother has done. Congratulations. You have very nice English. Here on the floor of the house, let us now ensure that those recommendations are put into action. And at a time like this, we confirm that indeed things are working. Thank you.
Thank you so much, Madam Speaker, for giving me this chance. Let me stand and say that, Madam Speaker, this issue of health facility has been there. We always discuss it. But I want to throw a spanner in the works because these reports, they are no different from the others that we've been receiving. But I want to challenge the Committee on Health, because before you give us a report, please, let's now call the executive, the CEO, all the directors of health, and get their opinion on what you find. Because, Madam Speaker, from this report, I can see the effort of the area MCA. This is an effort whereby an area MCA allocated money, they came up with a facility, but there is no uptake from the department. From what we are gathering here, only three workers, one nurse, one cleaner, and one security personnel. The committee could have gone further and tell us the status of this nurse. Is she permanently employed by the county? Is she under the terms of engagement with her? Because you can even find that the engagement is a local arrangement by the community. So, Madam Speaker, I want to challenge the Committee on Health. Next time, let's have the opinion from the department before we give our views. Because, as it has been alluded here, we've been giving out reports, but the aspect of implementation, it's wanting, Madam Speaker. So, I want to say this, that having a facility with no water, with no electricity, with no land documents, if they could have given that time and go to the department, they could have tell us the status from the other side. You might find even this facility is not known by the department. I wonder if that nurse gets sick or she or he engage in other issues, it means that that facility will not be open that day because we don't have any other personnel to offer the services. So, Madam Speaker, as I support these reports, I want to throw that spanner in the work. Next time, the department should be, just get the views from the department so that when we deliberate here, we'll find what the department is saying, because we might be using these reports to blame the department, and yet they are not even aware this facility exists. Because from what I see, having a facility with the staff establishment, 3 of them, 1 nurse, that I think we are not serious as a government. We need to be serious and do something about it, because the people of Solai or the people of Nakuru County, they need value for their money. They voted for us with a lot of confidence, and we have to put their issues first and give priority. So as we discuss about the issue of budget and all that, let's have what is the department saying about these facilities. We have a lot of them. We've given reports. We need now to see the other angle, the implementation. Thank you, Madam Speaker, as I support this.
Mheshimiwa De Gaulle, and then we can have Mheshimiwa Chemu, and then next, Mheshimiwa Evelyn.
Thank you, Madam Speaker, for giving this opportunity to give my views on this issue of Arus Dispensary. So as I support the report and say good work done by the committee of visiting this Arus Dispensary, there are some challenges which I have seen, which I have concurred with some of my colleagues, that they should be actualize the report, because I know we have been receiving so many reports, but the problem is to actualize, because if this facility doesn't have enough staff, they don't have enough, there's no water. I don't know how that facility is being run without water. There is no fencing. There is no ownership of the facility and all other things. So I would have liked, because we have other facilities, even we have some in our wards, which most of them don't have ownership. Yes, they have fences, but some don't have the ownership of land. So what we would have liked the concerned departments to do something about these missing things, like fencing, payments of the plot, because maybe one day, one time, the owner of this piece of land might say, no, he's going to own back his plot. What will happen with that? That facility will be closed down immediately. So we would have liked the concerned authorities to do something about this report, so that we have water, we have enough staff, we have drugs, and we have everything which is required in this dispensary. Otherwise, I do support the report. Thank you.
Mheshimiwa Chemu, I thought I'd given you the opportunity already.
Thank you, Madam Speaker, for this opportunity. First and foremost, I want to commend the good job done by Chair of Health and Committee Services, and also the members of that committee, for taking time to visit Arus Dispensary in Solai Ward, Rongai Sub-County. And as we understand that a healthy nation is a healthy nation is a wealthy nation. So according to the recommendation made by the committee, is that the staff in that dispensary are very few, according to the recommendation. And the recommendation made by the committee is that the county government of Nakuru should allocate resources the financial year 2025-2026 to recruit more staff and also nurses. And again, these health facilities has affected all of us, especially the 55 wards. When also we came there is a dispensary which has become a store for rats, because there is no allocation of money, and it has stayed for like 3 years ago without being equipped. So it's up to county government of Nakuru, the Department of Health, to ensure that each and every dispensary is functioning, because many residents are coming from humble backgrounds, and also the issue of lab, which has not been indicated here, is a major issue affecting our dispensary in our ward levels. So I think I support this motion, and I say that we shall work together to ensure that we have good health in our wards. And thank you, Madam Speaker.
So let's have Mheshimiwa Eva as the last one, and then we can have the mover come to respond and or reacting to the issues raised.
Thank you, Madam Speaker, for giving me this chance to also add my input in this motion. Madam Speaker, my concern is drawn to where we are told this facility is registered. Tell me how we can register a facility which has no fence, a facility which has no water, a facility which has no which does not have electricity. Madam Speaker, this picture, I don't know the picture. Madam Speaker, we have seen a lot going on from the ground. Nowadays, we see the 190 taking, I don't know what we call, in their hands. They are going on strike everywhere. Madam Speaker, I think it is high time we as the county government pull up our socks and be serious on what we are doing. Because tell me if one day or any other time, let's say, you see us in this assembly, the compound of the assembly is very neat because we are here. So if we are going to let our raya attend or being attended in those facilities, I think we are acting selfish or something like that. So kindly, we really want our people to be comfortable and live their lives well. So I really want to urge the Department for Health to really work on that, because that picture is not good, kabisa. Thank you, Madam Speaker.
Thank you, Madam Speaker. As I was going through this document, Madam Speaker, it has become a chorus on health department on matters to do with ownership of all health facilities. Madam Speaker, we need to come with a policy, and I remember very well once we were having a consultative meeting with Her Excellency, Madam Governor, and there was a data that was taken across the county where she instructed, and I remember very well because I was in that meeting, that all health facilities should be fenced. Madam Speaker, this issue we need to take it very seriously, so that when she said that all the health facilities to be fenced, that means she was to set some amounts of money after the data is being corrected, so that herself, as health was her agenda number one, should facilitate in matters to do with security. So it's upon the health committee and the Department of Rand, we follow up this matter so that we come into conclusion whether there was money set aside to fence all health facilities or not. Number two, Madam Speaker, on Easter Monday, I was having a consultative meeting with my electorates in a village called Gatamayo. And it happened, I was approached by a group of 5 middle-aged ladies, and they whispered to me, Mheshimiwa Kuria, this facility has one nurse and is a gentleman, very young gentleman. We do humbly. Can you go and try to convince the department whether it's possible we can have a ready nurse in this facility, so that each and every facility, I'm giving this an example when we come to understaffing, such that each facility within the county, Madam Speaker, can have a minimum of 2 nurses of opposite gender, Madam Speaker. This is because sometimes you find a middle-aged woman, a grandmother. Sometimes okay, it's like not ignoring, not rejecting, but they reject or they ignore being attended maybe by young-aged nurses. So if we can have, number one, a minimum of 2 nurses, number 2, of opposite genders, such that when maybe they can share their ideas. And I support Honorable Geru, Honorable Member from Nakuru East. He said that whenever there is instances that one nurse is sick, are you expecting any services within that facility? We expect that facility to be closed. So we need to rethink hard and make sure, Madam Speaker, that this facility is added another nurse such that we have a minimum of 2 nurses in all level 3 facilities. Madam Speaker, if you find on terms of acreage of this facility, the owner of this parcel of land allowed just fencing of 1 acre. That means that 1 acre was equivalent to the 800,000. So if the other 800 shillings can be allocated, he will allow the health department to fence this this facility. Now here comes the obligations or duty of the honorable member of that area to allocate the remaining balance of the 800,000 so that we can have now we can be called or termed the legal owners of the 2 entire acres of land. Madam Speaker, when you look at this document on page 7, it's true the Deputy Majority Leader have said, if you look at it very keenly, it's like a condemned structure. It is like a structure that has been banned. Now, this comes now within the Assembly, Madam Speaker. The team of communication, can we have advanced equipment on matters to do with, whenever we visit all the facilities, all the captured photos should be carried, Madam Speaker. This is because sometimes you find, even as the health team, when we are being taken photos there, unaona ni kama cartoon, Madam Speaker. Ni ukweli kabisa, ukiangalia vizuri. So I will urge the department on this assembly. Can we have proper equipment, the proper machines that will be able to provide transparent photos, pictures, such that you can be able even to identify who is who, which is which in all the health facilities. Madam Speaker, I say thank you for honorable members for supporting this motion. Looking and moving forward for more commitment to make that or to ensure that we deliver as elected leaders and we do our oversight role as we allocate and as we wait for more implementation or we wait for more projects on matters to do with health. Thank you, Madam Speaker.
Thank you. Before I put this motion to question, I want to comment on a number of issues that have been raised and probably give some bit of advice or directive to them. One Mheshimiwa has raised the issue of the health committee, bringing in so many motions and reports concerning our health facilities, and there has not been any implementation made on the same. And therefore to him it seems like the committee is doing a work in futility to keep going out there and bringing these reports. However, it is my feeling that the committee should continue with their oversight role. Let them continue going out there, bring many reports as per what is happening in our health facilities, because that is their work. As for the implementation, I think the relevant committee should be able or should pull up their socks and bring us the implementation status of the issues raised by these reports that are frequently brought by the health committee in the House. I would also advise that in as much as the committee would bring these reports, I think when they are writing their recommendations, it is good that they liaise with the CC relevant department to see what recommendations are doable within whatever timelines. So that when you're bringing your report, and specifically on certain recommendations, you can indicate for us how much time that the department is going to take to implement those recommendations. Concerning this specific facility, the Arus Dispensary, it is on record that the area MCA had sought a statement on the ownership of this land. He had sought that statement and he had requested to know when the pending bill of 800,000 was going to be paid, so that the facility or the county government can have full ownership of that land, and therefore maybe the title can be issued. So again, it's up to the Chair Lands Committee to respond to this petition. I would recommend that, together with the issues that have been raised, I would wish that the Lands Committee would respond to these issues within the first 14 days upon resumption from the long recess. Thank you, members. So I will now put the question to the motion that this House adopts the report of the Committee on Health Services on the visit to Arus Dispensary held on 18th April 2024 on the table of the Assembly on Tuesday 29th April 2025 during the morning session. As many as of that opinion say aye. As many as of contrary to the opinion say nay. The ayes have it. Clerk, next order.
Madam Speaker, those are the orders of the morning sitting.
Honorable members, this House is adjourned until 2:30 this afternoon.